This is just to make a case of how severe it is. So these are not so fun numbers from the CDC about fall. So 1 in 4 Americans age 65 years old and above will fall. So in 100, it's like 25%. 25 people will fall each year. 65, that is in 100 population. So you have to remember the age alone, 65 and above, is a predictor of fall. So 65 and above is a predictor of fall. So when you see your patient, or if your age, you know whether or not you are at risk for fall. Every 11 seconds, an adult is treated in an emergency room for fall. Every 19 minutes, an older adult, dies from a fall. So that's how severe it is. You count 11 right now, someone fell. Okay? Falls are the leading cause of fatality and most common cause of non-fatal trauma-related hospital admissions among older adults. So, right now we have a pandemic. Actually, fall is like an epidemic in older adult right now. It results in 2.8 million injuries treated in the ER annually, including over 800,000 hospitalizations and more than 27,000 deaths. In 2015, the total cost of fall injuries was $50 billion. Medicare and Medicaid shouldered 75% of this cost. So no wonder they're going bankrupt. This is just the fall, not to mention the other other medical conditions. The financial toll of older adult falls is expected to increase as the population ages and may reach by this year $67.7 billion dollars. So it's expensive. It's really detrimental to older adults if they fall. So the risk factors for fall, and this can be seen in the CDC website as well. There are intrinsic and there are extrinsic factors. So basically, when you say intrinsic, it is within your body, causes or factors within your body. Extrinsics are outside of your body. So as I mentioned before, advanced age, 65 and above, the age alone is a risk factor for fall. Previous fall, so that's why as a therapist, as a physical therapist, we always ask, have you fallen this past 6 months or 1 year? Because a previous fall can mean that the patient is also at high risk for another fall. I have had patients who fell like 4-6 times in 2 days, some of them in 1 day. And of course, the fire department was asked to come and pick them up. So most of them will deny of, going to the hospital until, sometimes the fire department will just get tired and say, hey, let's go. You really need to go to the hospital and be seen, okay? Muscle weakness. And I cannot overly emphasize this, guys. Muscle weakness is one, for me, in my clinical practice. Muscle weakness is one of the major causes of fall. Muscle weakness. So I would like to turn you guys to this slide here. So this is you might be overwhelmed with that. But this is from a research study, comparing the different research studies here, different research, different authors, saying that as we grow old, our muscles shrink, the muscle mass is losing, and of course the strength is losing. So we have decreased strength, decreased muscle mass. So there's so many numbers that you can see here. And this is the one I always tell my patient and educate them. It's between 20th and 80th year, we lose 20 to 40% of our strength. So as we grow old, we get weaker. You know, they say that, you know, you can see that 20th and 80th. So basically, the prime of our life is the first 20 years. And then after that, it's like going downhill. It depends what book you read. Some of it, it's like first 30 years, and then after that, it's going downhill. So practically, when you reach like 80 years old, it's almost half of your strength when you were young. That is the strength left unless you do something about it. And that's why in older adult, in therapy, resistive exercise within the tolerance, and if you consider, of course, the medical condition of the patient, resistive exercise is very, very important to decrease the sarcopenia or the loss of muscle mass and to improve the strength, because the reality is when you lose your balance and you cannot hold yourself up, it's because your muscles are not strong enough to catch you in the process of falling. So I'm talking about, Cindy, I'm talking about mostly leg strength. Core is also a part of it, but the core will be more on the posture of the patient. That also affects the balance of the patient. But the tripping over and not being able to catch yourself is more on the leg strength. You know, that is the most common cause of fall for me clinically. Okay, so the muscle weakness can lead to the gait and balance problem. Gait is walking. Poor vision, of course. If they cannot see where they're going, they can easily fall. Postural hypotension for the people who are not therapists. So postural hypotension is basically when you, from laying down to sitting, your blood pressure falls. From sitting to standing, your blood pressure falls. So there's a drop in blood pressure in change in position. So that can cause dizziness and loss of balance, and in severe cases, falling. Chronic conditions including arthritis, stroke, incontinence, diabetes, Parkinson's, and dementia are all considered high risk for falling. And we're going to talk about the fear of falling later on. This is a big thing also that we don't usually hear during discussion about fall, but actually there are research findings about fear of falling. So the extrinsic factor is, okay, I'm trying to read one of the question of Roberta. Can you please show which of your books you got most of this PowerPoint information? Okay, so you can see that the slide here, this is the book actually on every slide. So this is the Just Upright book. If you're asking about the references of this discussion, you can actually find all the research materials that I got it from in this book, 51 research reference here. So that is the book, Roberta. Okay, so extrinsic factors. So this is important, guys, because this is where we're going to educate our patients, our clients, our loved ones, and friends about what they can do practically at home to decrease the risk of falling. Okay, so handrails. So extrinsic factors outside of the body that can cause fall is lack of stair handrails. So having both handrails will be ideal. Some patients, they get too weak, they cannot really go out of the house. I had a patient, she said that she was confined in the house because she's a big lady, because she hasn't been out for 2 years because of the 2 steps outside. So can you imagine that the fear of falling on 2 steps practically made you housebound, you know, homebound, even if you have the capacity to actually go out. So if there's handrails, and if the patient is still able to navigate the stairs safely, it's ideal to have handrails. If not, ramp. I always say if there's a possibility, if it's not an apartment, if it is a house and they have the capacity to build ramp, that is more ideal, especially in times of emergency, going out of the house, of fire or anything like that. Poor stair design, lack of bathroom grab bars. So how many of you have had patients who have fallen in the tub, cannot get up? You know, I had a patient who fell in the tub. Um, her son came in, she was naked, and her son couldn't, you know, undo what he saw, and, you know, and he called 911 because he cannot help the mom to get out. And the mom, the patient actually was very shy because the fire department will come. So she actually asked for clothes because she was naked. You know, so there's so many stories about, you know, falling backwards in the tub, they cannot get up. Grab bars are ideal to have, and actually, if you're gonna put grab bars, shower chair, of course, you know, will be ideal for them to have as well, or transfer bench, so that will just put into the tub on the bench rather than stepping up. Dim lighting or glare, obstacles and tripping hazards. I have had patients, I will tell them that, oh, this rug, it's a tripping hazard, and they will say, oh, it's been there for years, it didn't bother me at all. So, you know, I would always say, well, you don't want to be bothered by it, you know, when you fall and actually sustain an injury. So, you know, it's okay to have uh, rug maybe that is, you know, it's non-skid, non-slip, but if they can get away without any rug at all, you know, it will be safer for them. Slippery and uneven surfaces, psychoactive medications. I don't know if you have had patients with, you know, they have fallen over and over again because they're actually doing, you know, high intensity drugs. Basically, you know, psychoactives are cocaine, alcohol, marijuana, anything that you can think of, or actually, you know, intoxication is another cause of fall. Improper use of assistive device. So, um, I don't know if you have stories, and most likely you have. I had a patient before, she's been using wide-based quad cane. It's a cane with, you know, for non-therapists, it's a cane with like 4 legs, prongs, and there's a wider side to it. And she bought it herself, you know, she had been using it, she had a fall, and it's because when she showed me how she was using it, the wider portion is actually near her instead of, you know, outward away from her. She tripped over the quad cane, basically. So, and then how many of you have had experience of, you know, well-meaning family members like giving their parents or loved ones walker, but it was too low, so it ended up, you know, that the patient actually is more you know, kyphotic than usual. Okay, so okay. Did I lose you guys? Or you're still here? Oh, you're still here. Okay, so just in case, let me see this. All right, just in case we lose connection, I will put this here. Yeah, okay, just in case we lose connection, just click this link and it will go back to this meeting, okay? All right, so let's go back again here. I'm trying my best to speed this up, but I think I'm not doing good with that. Okay, so, all right. So if you have a patient and they are kind of in denial, whether or not that they are a fall risk, There is, if you type on Google, yeah, check your risk for falling, and CDC, they will see this form, okay? And this is the form that they can answer for themselves, give them an assignment. Okay, for you to really assess yourself, whether you are at risk for fall, here's the form, okay? Look at this. So here, this is a grading system in which if the patient ended up with 4 or more score, they are automatically at risk for fall. 4 yeses. So look at the first two. I have fallen in the past year. I use or have been advised to use a cane or walker to get around safely. So falling and using assistive device to walk, those are two biggies for being high risk for fall. The third one, sometimes I feel unsteady when I'm walking. So feeling of unsteadiness is a sign of poor balance. Here's what I'm telling you about, guys. I steady myself by holding on to furniture when walking at home. So again, this is a red flag. This is a sign of a future fall about to come. It is not if, it is when they're gonna fall. I am worried about falling. I need to push with my hands to stand up from a chair. So if you're a therapist, you know very well that if a patient uses their hands to push themselves up, it means that their quads, specifically the muscle in front of your thighs, their muscles of the legs are weak. So they must use their hands to push themselves up, okay? So something must be done. Some strengthening of muscles must be done. So that is the reason why there are some tests, the sit to stand test. Ideally, if you do that test, the patient should not be pushing on the chair, but if they push on the chair, that's called the modified sit to stand test. So, and you can look it up, CDC also have the forms for that. And actually it's in the book also, if you want. At the back portion of the book, there's a clinician corner with the latest tests that is very quick and easy to do, and that you can document real well if the patient is a fall risk, not just observation, but a standardized test. Okay, I have some trouble stepping up on a curb. You see, weakness of the leg. This is weakness of the leg. Okay, so weakness of the leg is one of the most common cause of falling. I often had to rush to the toilet, and that is a higher chance of falling. I have lost some feeling in my leg. So patients with diabetes, or peripheral vascular disease, those patients are at risk for fall, okay? I take medicine that sometimes make me feel lightheaded or more tired than usual, blood pressure medication. If they had so much, their blood pressure can fall, they can be dizzy, they can fall. I take medicine to help me sleep or improve my mood. So these kind of medications, the psychotropic medication for mental illness, it has one of the main side effects is dizziness, okay? I often feel sad or depressed. And depression is really closely linked to falls. There are many research studies around there. Depressed people has a high tendency to fall. So again, you can see this on a CDC website. Check your risk for falling. It's a great material. If a patient is in denial that they are a fall risk, then they can see for themselves. Thank you so much for watching, and remember to hit the subscribe button below. It is for free for the latest video updates. Thank you for your support and stay blessed.